All right, everyone, this is being recorded, so welcome to the health insurance webinar. Sorry for the little informal impromptu beginning, but we have Louise here with health insurance, and I'm going to let you take it away, and I'll be here to help in the chat if needed. But everyone, please use that Q&A if you do have any questions. And Louise, you'll probably say this, but if you have any specific personal questions, it's best not to ask them publicly. We can always follow up with an email if needed. Right.
All right. Well, thank you, Haley. Thank you, ISSC, for this opportunity to meet with our incoming graduate students. My name is Luis Galaz. I'm representing ASU Health Services in our Student Health Insurance Department this morning. And again, we want to welcome you to ASU for the Spring 25 semester. Now, we do want to introduce you to our Student Health Insurance team. Some of our team members are on this meeting. First of all, I want to again introduce myself. My name is Luis Calaz. I help manage the Student Health Insurance Department, our Education and Outreach team, and I help supervise the referral department. We have Jessica Creed, who also works in the Student Health Insurance Department and is our referral specialist. We have Kristen, Isaiah, and we have Mohammed and Apurva, who just joined our team and are going to be working with our international students this semester as well. So we want to give you our contact information. We want to do a quick introduction and also, again, welcome you to the Spring 25 semester. Now, we do want to talk about specifically this morning, your student health insurance plan. We refer to it as SHIP throughout the semester, and also how to access medical care on campus and off campus as well. This is going to be very important information. It might not be needed at this particular moment, but at some point during your stay here at ASU, you probably will be needing these services. So it's better to know this information ahead of time before it's actually needed. A lot of frequently asked questions that we get from students each semester is, what is the name of my insurance company, or who's the insurance carrier? Will I be receiving an insurance card that identifies and gives me the details of my insurance? Okay. How much do services actually cost now that I'm purchasing this insurance through the university and it's required? Where do I go for care? Okay. If I do have a medical situation or I need to talk to a counselor, where would I go? Where do I begin? Okay. Can I go to appointments in person or through telehealth? Okay. How can I schedule an appointment? And who can I contact if I need assistance throughout the semester? So those are some of the basics. We're going to try to answer those, and not in that particular order, but we're going to also have some opportunities for questions and answers at the end. And again, more detailed questions regarding a specific medical issue, we would be able to help you through your patient portal and in person throughout the semester if those are things that need to be addressed. Now, we do want to start with the US healthcare system. As many of you probably have heard or are aware of already, the US healthcare system is very different than most countries. Here in the US, medical and healthcare is unaffordable if you do not have the proper health insurance coverage. Now, we also want to let you know that health insurance coverage in the US does not mean that everything is covered at 100%. And once you purchase it, everything is free moving forward. There are some out-of-pocket costs that individuals are responsible to pay. And we'll go over those in just a few slides down. And it's going to be important that you understand that this is just a general overview and introduction into your student health insurance and medical care on campus and off campus. We're going to strongly encourage you to continue to look at your policy and learn and get better understanding on basic guidelines of your insurance and healthcare. And one of the great things is that we're going to be doing some workshops throughout the semester that's going to give you the opportunity to learn more and to ask more questions and to continue to grow in your knowledge of your insurance and of healthcare here in the US. Now, here in the United States, there's a lot of different insurance companies. Your insurance company is United Healthcare Student Resources. United Health Plan is the largest insurance company in the US, but specifically yours is called United Healthcare Student Resources. There's two main reasons that you are required to have insurance here in the US. One is to provide coverage, so when you get sick, maybe you have an injury, and also for preventive healthcare and services. Okay, we want to make sure you're healthy and you stay healthy. We believe that wellness equals success. And if you're in good health, you're going to be successful, not only academically, but in all areas of your life. So again, it's important to stay healthy, but you can't really talk about your health without talking about insurance and who's going to pay for the cost. Now, also, the second main reason that you have health insurance in the United States is to protect you from very, very expensive medical bills. We already kind of hit on that point, the slide previous to this, that healthcare in the United States is extremely, extremely expensive. So having this insurance and learning how to use it and where to go for services is going to protect you from very high medical bills. Now, this United Healthcare Student Resources SHIP plan, Student Health Insurance Plan, is a top-tiered insurance plan. Okay, it's one of the best, if not the best, that I've come across in many years working with a lot of families and students throughout the United States. We do want to let you know that Spring 25 coverage began on December 4th. It will go all the way through the spring and summer sessions and end on August 15th. You can see the premium rate that was billed to your student account. And we just want to be clear that every year when this is billed to your account, spring will include the summer, and the dates and coverage periods cannot be changed or adjusted. So fall, you'll be covered from August 16th through December 31st for the fall, and it has one price. But since you guys are starting in the spring, it automatically includes the summer. And this is whether you're enrolled in summer courses or not, you're covered. Again, we mentioned that it is required for international students. So every semester when you register, the fee will automatically be placed on your account. So as you check your student finance account every semester, you want to go through every line item to confirm the student health insurance plan fee was added, and it's an automatic thing. It doesn't hurt to double check. And you have that fee on there, you know that you are required to have it, but also you're protected and you know where to get your care. Now, for students that are under the age of 19, dental and vision services are covered under this plan. If you're 19 and over, dental and vision are not covered under this plan, but there's a dental discount program that you can purchase, and we can talk about that a little bit later and provide more details on that as well. Just another thing to kind of make clear here in the United States, medical care is covered under a medical insurance policy. For the most part, dental is a separate insurance policy, and vision care is additionally also a separate policy. So that's kind of how the US healthcare system works for the most part, just to give you kind of a quick overview. They're not all included together. Now, this is one of the most important slides. The question here is, where do I go for care? Okay, again, this is a lot different than most students that we talk to from around the world and back in their home country. For primary care and most care that you need, ASU Health Services and ASU Counseling on campus are going to be your first stop. We refer to this or call this primary care. The insurance company requires this. We have comprehensive health centers on each campus, so it just makes sense. It's easy, it's convenient, and with your insurance, it's going to be very affordable. If you were to need something off campus, such as a specialist, maybe you need to be referred to a dermatologist, You might need a physical therapy. Might need some type of special procedure, an MRI or a CAT scan. You still have to come to the health center first. And the provider here at the health center or the counseling center must provide you a referral. And the referral is a requirement of the insurance company to be able to go off campus and connect with that specialist. If you were to go to a specialist without a referral, the insurance company will not pay for that visit, and that cost will be your responsibility. So this is one of the first kind of guidelines and policy details that are crucial in understanding with your student health insurance. You are required to get a referral from the health center or counseling center to specialist off campus. Now, we also have here in the United States what we call urgent care. Urgent care are facilities off campus, and these urgent care facilities are usually open later than the health center. They'll maybe open on weekends and on holidays when perhaps the health center is not open. Urgent cares are also good in a situation where perhaps the ASU Health Services may not, in the rare occasion, have an appointment available within a day or two, or when you might need it and you feel like you do need to see a provider as soon as possible. Then we would refer or encourage you to look for an urgent care that works with your insurance company. And in a few minutes, we'll let you know how you can determine what urgent cares or what providers off campus are contracted with your United Healthcare Student Resources. So again, urgent cares are not for life-threatening emergencies, but they are for immediate concerns when maybe the health center is closed, or perhaps when you can't get an appointment soon enough here at the health center. Another facility or location that you may need is an emergency room. Emergency rooms are usually located at hospitals off campus. An emergency room is completely different than urgent care. Emergency situations are pretty much a life or death situation. And in these kind of cases, there's really nothing to think about. You would either dial 911, pick up your phone and dial 911 so the ambulance can come pick you up wherever you're at, or go to the nearest hospital emergency room. This holds true for whether you're off campus or even on campus. Okay, if you're anywhere on campus and this is a life-threatening emergency, you should dial 911 or go to the nearest emergency room. The ASU Health Services or the health center on campus is not an emergency room. It's not determined an emergency room. Obviously, if you come in, we're going to assist you and take care of you. But again, in an emergency, whether you're on or off campus, you dial 911 or go to the nearest emergency room. For urgent care visits and emergency visits, a referral is not required by the insurance company. However, if you were to go to urgent care or an emergency room and they want to write you referrals to specialists, you do have to come back to the health center as soon as possible and get those referrals issued by ASU Health Services on campus. Okay. And again, anytime you were to go off campus to an urgent care facility or emergency room, you want to make sure you stay in United Healthcare Student Resources or your SHIP Plans network. And in just a few slides, we'll let you know how to determine who's in your network and how to establish that. We did talk at the beginning of this presentation that although you have insurance, and this is one of the best insurances you can probably have, it's a top-tier insurance policy here in the US, there are some out-of-pocket costs that you do have to pay for out of your pocket when you use your insurance. Okay. On campus, there's only two fees or two charges that will be billed to your student account. And one is for an office visit to the health center. Visits to the health center are always going to be a $15 fee. If you needed labs or x-rays, we do those here on the Tempe Health Center. Those fees will be billed to your student account probably within 5 business days. So those are the only two fees that you have on campus. $15 for visits, labs and x-rays are $10. I do want to point out, if you do need to go to the counseling center on campus, ASU counseling services, there is no cost. That's covered at 100%. But for your medical visits, it's a $15 fee. Labs and x-rays are $10, and it gets billed directly to your student account probably within a week. Off-campus. Okay? Off-campus fees are noted here on this slide. They are paid to those providers that you're visiting off-campus. These fees are not billed to your student accounts, so be aware of that. But we did talk about being in network and having referrals that are required by the insurance company. So if you go to an office visit off campus, that will be a $25 fee. If you go to an urgent care center, that's a $25 fee. Emergency room visits are $200. If you need to be hospitalized and it's in network, or perhaps you need a surgery, whether it's a minor hospitalization or surgery or a major, you would pay $250 plus 20% of the rest of that bill. Prescriptions, you pay the first $125 of your prescriptions at full price. Once you meet that 125 threshold, then your prescription is pulled into a category. And it, depending on that category, moving forward, your prescription will cost $15, $40, or $80. Now, a lot of students ask, well, if I have insurance, then what's the point if I still have to pay out of my pocket for services? Again, this is just a small, very small fraction of the cost for these types of services or medical care here in the US. But the next bullet point highlights the importance of this insurance. Your maximum out of pocket is $1,500 for an entire school year, fall, spring, and summer, of $1,500. This means that whatever you are responsible to pay under this insurance policy, whether it's $25 for an office visit, whether it's a hospitalization, whether it's a surgery, whether it's a prescription medication, you are protected under this insurance plan of not paying more than 1,500 US dollars in one school year, fall, spring, and summer. And although this is a lot of money in the US, it's not considered a lot of money. It's actually the lowest threshold that I have seen in the last 5 years here in the US. So this is a really good protection built into this insurance policy to protect you as long as you're following the plan's rules and guidelines and staying in network and getting referrals as needed. Now, one of the requirements as an international student is that you will have to go to United Healthcare Student Resources website. Okay. This is going to be the insurance company's website, and you're going to have to create an account, okay, with them. As you go to the website, there's going to be a sign in, somewhere to sign in. You first have to register. You're going to have to register and create an account, and then you'll be able to actually sign in the next time you come back in. This is where you're going to go in and you'll have tools that are related to your insurance company. This is where you're going to go to learn more and figure everything out and communicate with the insurance company directly. You'll have the opportunity to print your ID card or download it. You'll be able to review your plan information details. This is also where you're going to be able to look up and find in-network providers that are contracted with your insurance company. Okay, we can't stress it enough that you must stay in the network. How do I find or determine who's in the network? You'll be able to actually go to the website, type in the city or the zip code that you're in, and find those in-network providers. And there's going to be a lot of additional resources in here. So this is the first step that we're encouraging you to do, is connect with your insurance company, create your account, register with them, kind of take a few minutes to go through the website, print your insurance card, play with the tools in there, and figure out how to find in-network providers. Now, on your insurance card, when you do print it out, you will have all your name, the policy details on the front of the card. You'll also have a customer service phone number where you can call and the insurance company directly, their customer service, to get assistance and ask them questions directly. So you're going to have multiple places that you can get help and support with your insurance company throughout the semester, but you always want to start with them. But we're going to also provide our information and our details because we're also going to be available to support you throughout the semester. Now, ASU Health Services is located here at the Tempe campus. We're off of Palm Walk and the University Bridge. But we also want to let you know that we have a health center on all our locations. We have one in the downtown campus. We have one on the Poly campus. We also have one on the West campus. And you as students have access to any of our health centers. Okay, you can make an appointment at Tempe. If you're going to be taking a class or you're living in downtown, you can make an appointment there. And you can change and use any of them depending on your schedule and your needs. But again, we have 4 health centers on 4 of our campuses, and you have access to every one of them. Now, ASU Health Services, it is my understanding, and not my understanding, but the fact is that we are a comprehensive health center. We're easy to access. We provide high quality healthcare for students on campus. It takes away the need to look for transportation, to travel miles for basic, routine, and things that you can get taken care of on campus. We have board certified providers, physicians and nurse practitioners. We do primary care, preventive health care. There's women's health on campus. There's labs and x-rays at the Tempe campus. We do immunizations or vaccines, sports medicine, telemedicine, and we also have a after hours medical advice hotline. So when you call the health center, and it's our general number, after hours, you will be connected to a provider that will talk to you live and give you medical advice if needed. Again, this is not a substitute for an emergency, or it's not a substitute if you have to go to the emergency room or go to urgent care. But if you're not sure and you just want to talk to a medical provider, you have a question, you can call us after hours and there is somebody available to talk to you. Now, we do want to let everyone know that everyone has a patient portal. It's called My Health Patient Portal. You'll be able to access this through your My ASU account. Under the Campus Services tab, there's a link that says My Health Portal. This is going to be your go-to portal for your medical care on campus. Okay, this is in a very secure, protected environment where you'll be able to make appointments. This is where you'll be able to send us messages, different departments' messages at the health center, whether it's the student health insurance department, whether it's the billing department, whether it's our referral department. You'll be able to do all of this through your patient portal. You'll also be getting messages through your patient portal throughout the semester. You'll be able to access your medical records once you start being seen here. So this is going to be your go-to for medical care on campus. And you'll also be able to communicate and make appointments with ASU counseling through your patient portal. Again, I'm going to encourage you to take a few minutes to log into your My ASU account, go to the Campus Services tab and click on the patient portal and see the different services and different tools that are in there so you can be familiar and get comfortable with this. So if you ever need to use it, you already know how to navigate through that. You'll also be able to contact us via telephone. Our numbers are on the screen for ASU Health Services and ASU Counseling. But again, we want to direct you back to your patient portal for pretty much all your care here on campus. Again, information and assistance. We have our ASU Health Services website, our ASU Counseling website. Again, I cannot stress this enough. Please take a few minutes to visit these websites, navigate through them, and you're going to get a better overview. You'll get some more details on what we're trying to share. Okay, you'll get more comfortable with these services and navigating the healthcare system here on campus and off campus and with your insurance company. If you, again, have a question for us and it's more specific, you reach us through your patient portal. When you create a message, there's going to be an option for the student health insurance department. You can send it to us directly. Usually we're good at getting back within 2 or 3 business days. Also, you can visit the United Healthcare Student Resources website. We already gave you the link so that you can go create your account with the insurance company and pull your insurance card and kind of see what tools are on their account, so you can learn how to navigate with the insurance company. We do want to highlight ASU Counseling does have a 24-hour number that you can call. It's a crisis hotline. It's dedicated to ASU students. The number's on the screen. And if you ever need to talk to a counselor, there's always going to be someone that's available to talk to you, whether it's at the health center or through the Impact 24-hour dedicated crisis hotline. And there's also an app. It's called Open Call, Open Chat that's available through the counseling center. You can click on the link, and that is an app that you'll be able to talk to someone in counseling services 24 hours a day, 7 days a week from anywhere in the world. And that's a service that's free, and it's provided to all our students. So we want you to be aware of that as well. Now, this is, again, a brief introduction into the student health insurance plan, into medical care on campus, some basic guidelines and policy details to get you kind of started. We also want to let you know that we're going to be having specific workshops that are aimed at students on the student health insurance plan throughout the semester. We'll be reaching out to you through your patient portal and sending you invites through that channel. But also the ISAC graduate department will be sending out information through their channels to let you know about these workshops, where we're going to dive a little bit deeper into some important areas and items regarding your student plan and healthcare. So again, this is a very brief introduction, and I don't know if we have the opportunity to take any questions at this time. If so, I would be more than happy to take any questions through our chat feature or live. And I don't know
Yeah,
if,
there's some Q&As actually. They're just starting to join or starting to post them. If you like, I can read them, or if you want to just pop in there, I think that would be great if we just answered them live so everyone could hear them.
yeah, can you read them off to
Yeah,
me, Haley? That
absolutely.
would be good.
So one individual asked, I want to know if we can do a full body blood checkup. Is there, um, is it included for heart, liver, chest, kidney, and blood? So I guess, kind of details about what
Yeah,
kind of checkups they
yeah.
could
So
have.
that's a good question. There's all kinds of doctor's visits, but one that is covered at 100%. It's one a year is a routine um, checkup, and it could be referred to as a routine checkup that you would make an appointment with one of our providers. The providers would go ahead and go over, with the details on that appointment, but they'll go ahead and order the labs that kind of relate to that type of appointment. So in other words, the provider would have to order the labs that kind of go along with that specific type of an appointment. And if it is required, or it's something that's requested by the provider, it should be covered at 100%. Now, I do want to go back to the idea of just kind of every and any lab work would be covered. Again, here in the United States, again, the healthcare system is very complicated. And just kind of to try to simplify it as much as possible, insurance companies will usually cover and authorize something that a provider requests if it has the correct coding and there's justification as to why that would be needed. So again, that's a conversation that you would have with the provider. If there's something going on with, there's might be a medical concern, or there's a medical issue going on and they want to order some blood work specific to liver testing and other testing, then it should be covered. Again, I'm not sure if it would be covered at 100% as a routine checkup, or you might have that $10 copay depending on how it's coded by the provider.
Thank you. And we did have questions about these slides. So if you're an international graduate student, we've asked you to join our resource hub. I'll put a link in here for self-enrollment, but we do update these slides onto the resource hub. If you're not a graduate student, please just send me a message, and we have no problem sharing the slides as viewer only. So you'll be able to look at these at a later date. So please message me if you are not a grad student, and if you are, I'll put the link to our graduate resource hub, which we always update the slides and a recording of this onto that. It takes a little bit more time for the recording, but we do update the slides. So for the next question, after a student is graduated, so this is kind of a larger question, but I think you still can answer it. After a student is graduated and then they start looking for a job, will they get a new insurance from the new job only, or can they apply to their previous, I'm guessing, to what they're provided now? Or can they
Yeah,
apply
yeah.
privately, I guess? Yeah.
Yeah, so that's a very good question. And so this is a special insurance policy for ASU students. And so once you graduate, depending, like say you graduate in the spring, as we talked earlier, usually students who graduate in May will have coverage through August 15th, even though they graduated already. So that's one of the big pluses for students who are graduating in May. They're still covered until August 15th, whether they already have a job or other insurance lined up somewhere else. Okay. For fall, students usually graduate, I believe, on the first week by like the 5th of December. The student health insurance will be good and active till December 31st. So the period is not as long, but there'll be probably like 3 weeks of coverage. And then at that point, obviously the coverage would end. So if you're an international student, usually you're going to be kind of probably looking for OPT and looking for a job. And most people here in the US do have their health insurance through their employer. So I would assume that your employer would provide your insurance if you have a job lined up already. If you don't, once the insurance ends here, you would have to look or purchase insurance outside of the university. And if there's students in those situations, we could help educate you. We can help you learn to navigate and what to look for, what to ask, so that you can make an informed, educated choice, excuse me, on health insurance outside of ASU. But once you're no longer an enrolled student, you're no longer eligible for the SHIP plan here at ASU.
All right. Next question. Um, So they were having a hard time joining. So for that person, again, we'll have the recording provided and we'll have the slides. But they just wanted more information, kind of an explanation again, of deductibles, copay, out of pocket. I know it is different when you move here, and it is honestly different with every health plan. So I think if you don't mind kind of going over that one more time, I think our students would appreciate it.
Yeah, so again, we get so many students from all over the world, and it is kind of a really strange concept where, even here, us in the United States, we're still kind of trying to grasp everything and understand health insurance and healthcare because it's so convoluted, it's so involved, it's so complicated, and each insurance plan is different and has their own guidelines and has their own rules, But here in the United States, again, although you're purchasing health insurance and you pay for it, you're pretty much gonna have some responsibility and some of the cost of your healthcare still, even though the insurance company is gonna pay for most of the cost. In this particular case, your student health insurance plan is considered a top tier insurance plan. And in the US, they categorize plans by metal levels. The highest level is a platinum level. The next level down is a gold tier level, and so forth. Down is silver, okay, and then bronze. Okay, so you have the top tiered insurance policy, which is a platinum level. And basically what that means is that this insurance policy, in the big picture of things, will end up paying about 93% of your medical healthcare costs, okay, for you, and you'll end up paying 6 to 7% of your healthcare cost out of your own pocket. So really, although you have the best insurance plan that you could possibly have, you're still going to pay 6 or 7% of the cost, and in different shapes and forms and places, and where, depending on where you use it. So again, we talked about primary care and your first stop being the health center. And one of the biggest reasons that this is also going to be your first stop is because, again, most of your care can be done at the health center on campus, and you only have a $15 fee for an office visit. Okay. Versus whether you get a referral from here and you go off campus to a specialist, then you'll have to pay $25. Or if you go to an urgent care, that would be $25. Or if you wanted to go to the emergency room, that would be $200. So again, depending on where you go, what you need, that's going to determine how much you pay out of your pocket. So we want to educate you again to where primary care is at, why you would go to the emergency room, because if you go to the emergency room, you will pay a little bit more. And we want you to go to the appropriate places for the appropriate services. Again, we do hear back from a lot of students in other countries that usually you go to one, like maybe hospital or medical center, and all your care is done in the same place. They have different departments, but pretty much you go to the same place for everything you may need. But here it's a little bit different. Okay. So again, healthcare costs in the United States are very, very expensive. The insurance company will end up paying about 93% of the cost, but you will be responsible for paying something out of your pocket. And then again, as you get to that 1,500 maximum out of pocket limit, then after that point for the rest of the school year, then you wouldn't be responsible to pay anything. So let me give you an example. If you went to the hospital for 3 days and your medical bill is $100,000, if you went to an in-network hospital, everything's covered by the plan, although you do have to pay some things out of your pocket. Once you pay $1,500, the insurance company would pay the other 98,500 US dollars for you. And for the rest of that year, you wouldn't pay anything else for any other medical care you would need. I don't know if that answered the question, but again, it's kind of painting the picture that although you do have to pay some things, the insurance company ends up paying most of it.
I think that was very helpful. So I guess if they go on campus, right, it's much smarter to come to campus first if possible, and it's going to be cheaper, right? So I think that's an important thing to remember as a student, is to utilize your resources on campus before you go off campus. Of course, unless if it is that emergency, then an emergency is an emergency. Um, yeah, and I
Also,
think, go ahead, go ahead.
Also, since we're kind of talking about this, and I don't want to forget, and one thing I didn't point out is that as we spoke, all insurance plans and policies are different, and they all have their requirements and guidelines and things that need to be followed by the member. One of the things that makes this student health insurance or SHIP plan very special and unique for you as a student, especially international students that I talk to, are going to be traveling. That's one of the big pluses as being an international student in the US, is that you have the opportunity on weekends and holidays, on breaks, to travel throughout the US. This insurance policy has coverage throughout the United States. And I do want to point out that once you go beyond 50 miles of ASU, whether you're in Arizona or in another state, Los Angeles or New York or Chicago or wherever you're at, you have coverage. The only thing you have to do is go on to your insurance plan's website or call the customer service on the front of your card to find in-network providers that are contracted with your insurance company to get medical care anywhere in the US. And a lot of health plans here in the US don't provide that service. They're usually local networks that just work in Phoenix, the Phoenix metropolitan area, or perhaps in the state of Arizona. But this particular plan has coverage throughout the US. So please be aware of that.
Thank you for that. Something that I think is like not a bad thing to mention of, would you mind providing some examples that would be appropriate things that are emergency and maybe things that might not be an
Yeah,
emergency and worth
yeah,
kind of making that appointment or seeing someone on
yeah,
campus, just so our students, I do think it's sometimes different in the US than other places of what we kind of identify as an emergency, where
yeah.
you, yeah.
Yeah, so an emergency would be something again, more on the life-threatening, more on the very serious situation, more on like if I don't get to a medical provider now, really bad things are going to happen like now. An accident, would be considered an emergency, whether that be a car accident or maybe you're biking and you know, again, get hit by another vehicle, or perhaps you have some serious chest pain. Maybe you're having problems breathing. Maybe you are playing a sport and you break a leg. You break a bone or something of that nature. Would be more on the emergency side where this just can't wait. I need to see a medical professional now. Okay, and again, you would dial 911 or go to the nearest emergency room. Now, for urgent care, we would think like, hey, you know what? I have a pretty bad cold or flu. I think I'm running a fever. I'm getting, body aches. I try to make an appointment with the health center. There's nothing available today. It's Friday. There's nothing available today. They have an appointment available on Monday or Tuesday. But you know what? I can't wait till Monday or Tuesday to go to the health center. I'm feeling really bad. I want to talk to a medical provider today, maybe get a prescription to try to feel better over the weekend. I got a big week planned next week. And so at that particular point, then we would probably recommend that you go to urgent care off campus. And again, this is not a life-threatening emergency, but it's just something that can't wait. It's urgent. It can't wait for a day or 2 or 3 days to go to the health center. And in that particular case, again, we would recommend that you go to urgent care. And again, urgent cares are kind of like the go-between between the health center and emergency rooms. And again, urgent cares, once you look on your United Healthcare Student Resources website and find urgent cares around the campus, you'll want to kind of find out where they're located and call them to see what their hours are, because every urgent care has a different business hours. Some of the urgent cares might be open till 6 o'clock every evening. Some might be open till 8 o'clock in the evening. I found some that are open till 10 or 11 o'clock in the night. You'll want to know, hey, are they open on Saturdays if something happens on Saturday or Sunday? Are they open holidays? Because if the health center is not open, what's my second option? My second option would be urgent care. Depending on the situation, but emergency rooms are usually open 24 hours a day, 7 days a week. So in a life-threatening emergency rooms are always going to be open and available in that situation. But again, urgent cares have different hours, so you want to make sure you know what their hours and where they're located. And then ASU Health Services, we're on campus. Again, we encourage you to go to our website. We encourage you to come check out the health center. Just walk by it, walk in, just get familiar with what it looks like. But we're open from 8 to 4:30, Monday through Friday. We're not open in the evenings or on weekends or on university holidays. But again, that's where urgent care would come in if needed.
Great, thank you. Does anyone else have any other questions? It can be simple or complicated. We can always do our best to see if it can be answered.
I do again strongly encourage you, because again, we talk to a lot of students, and again, this is very critical and important information. But a lot of times, this might not be a priority because no, you might not feel sick. There might not be a medical issue. You might worry about it, or kind of maybe look into this when and if necessary in the future. But we think it would be worth half an hour of your time to look through the different websites, to make sure you go to the insurance company's website, register, get your insurance card. Make sure to carry your insurance card with you at all times as well. Carry it in your wallet or download it on your phone. because anywhere you go, whether it's an emergency or whether you come here to the health center or urgent care, or you get a referral to go to a specialist, they're going to want to see your insurance card information because that's how they're going to bill the insurance company to pay for 93% of the cost of those visits. Okay, so without that insurance information, the providers can't bill the insurance company to get paid. And you don't want them to bill you because you didn't have the insurance information available. But again, it will be more than worth your time. So that way, when the opportunity or the situation does come up to use your insurance and get care, you kind of have a really good idea how to start navigating that.
Great, thank you. So someone asked, how do they get their insurance card? Are regular appointments charged? So I guess that's two questions. So first one, how are students able to access their insurance card?
Yeah, so am I still sharing my screen or did I mess it up
No,
here?
you did. It's white right now. But
What's white?
so
Okay,
now we can see MSN. Yep,
okay,
now we're back to the slides. Excellent.
okay.
And these
Let
are
me
all
see.
great questions, everyone. Even
Yeah,
if it's
yeah,
something that we may have talked about, we want to make sure you definitely understand. So it's okay
yeah,
to keep asking to make sure that we're all
definitely.
explaining it in ways that you understand. So keep them coming.
Yeah, and the great thing about these orientations and workshops and the opportunities we have to share with our students is that we believe that you will share this with other students or colleagues, of yours, that maybe didn't attend the workshop or this presentation. And also, if there's ever an opportunity to help someone, then you can help them navigate it. Because again, we know a lot of people, once this information, they didn't get it, maybe they didn't, understand it. But if you can help somebody kind of learn to navigate and point them in the right direction, it's going to help them so much. And so we appreciate, all the questions you guys have. But this is where you would go to the United Healthcare Student Resources webpage. This is the insurance company's webpage. And one thing I do want to distinguish is that United Healthcare Student Resources is separate from ASU. We are not the insurance company. We are just the department that helps make sure you're enrolled. We help educate you. We provide support and assistance. But at the end of the day, ASU is not the insurance company. United Healthcare Student Resources is your insurance company. This is who you have your policy with. So we will direct you to their website. Once you get to that website, on the upper right-hand corner, I believe, of that web page, there's going to be a sign-in, and you click on that, and then you'll have the option to register or to sign in. If this is your first time and you're new here and you have not done it, you would first register. And when you register, you use your name, your last name, your date of birth, and your ASU ID number to register, and you create an account. Once you create that account, the next time you come back, you would just hit the sign in button because you have created an account. This is where you'll go in, and there's a lot of tools in here. And one of the tools is you're going to go ahead and print or download your insurance ID card and make sure you have a copy of that. Again, you can review your plan information. You'll be able to find in-network providers. And there's all kinds of other tools in here that you can play around with and navigate and kind of get comfortable with that web page. And then what was the other question, Haley? I'm
Yeah.
sorry.
So then are regular appointments charged? So I think that's, whether it's walk-in and or whether it's an appointment that they
Yeah.
made.
Yeah. So here at the health center, again, all appointments, regardless of what the appointment's for, unless you have one routine checkup a year provided with the insurance plan, for free at no cost. But all other visits, regardless of what it's for, are going to be a flat fee of $15. Okay, labs and x-rays, which we do here at the Tempe campus, are a flat fee of $10. Now, just to kind of like paint the picture a little bit more, visits to the health center without insurance here can run on the low end. And again, I don't have updated information, but on the low end, if you did not have insurance, a visit to the health center can run $85 to, I believe, almost $200, depending on the type of visit. Labs and x-rays can run anywhere from like $20 to $25 to hundreds of dollars for labs or x-rays here at the health center. So again, just to kind of put things in perspective and to kind of give you a little bit better picture. With your insurance, you just pay a fat fee of $15 and $10 for whatever it is that you need here on campus. Okay.
Thank you. So does anybody, we have about 7 minutes left, so feel free to add any questions. Of course, if not, we will probably end our session a little early. But we'll give you another minute or two to kind of throw in any questions. So I'll ask a question just to give anyone time to kind of type anything in. But I guess maybe, are there any common misconceptions or maybe areas that you see students finding challenge in? Something simple as, for me, I know a lot, you can have your insurance card on your phone, but sometimes if you're in an accident or your phone is dead, you don't have access to that. Is there kind of some simple things that students might often not think of doing, or you might have like a quick tip for students as they might be writing any more questions?
Yeah, so one of the important thing is the ultimate reason why we're here is to make sure that you're healthy and you stay healthy, okay, and to help you avoid very expensive medical bills. So with that being said, one thing that comes up is that sometimes, again, it's a lot of information, things happen, at different times. But one thing that comes up every so often is that students will say, you know what, I didn't have my insurance card, and I wasn't sure if I could go to the emergency room or not in an emergency. We want you to just get to that emergency room, and if you don't have your card, you can always check with us the next day or ask us for help or go in to the insurance company and pull it from there and then provide it to the emergency room a couple days later. Okay. The important thing is that you went to go get the care that you needed at that time. Okay. Same thing here at the health center. Okay. You know what? Oh man, I made an appointment. I'm on my way to the health center. I didn't, I forgot my insurance card or I never printed it out. Maybe I won't show up to the appointment. No, come to the appointment. We'll work with you. Makes things a lot easier for you and for everybody. But at the end of the day, we want you to come to your appointment even though you don't have your insurance card. Okay, we'll assist you with that. But the bottom line is that this is all set up to make sure that you get the care that you need when you need it and you stay healthy. So again, it would be a lot better if you can take some time and do all of this now ahead of time and again, share this with other students. But if not, um, there's something that could be done after, and you could provide your insurance information days after, as long as it's within a reasonable time, usually within 2 to 3 business days.
Luis, I have a quick question. I think one of the students asked me that earlier. Just to go over it quickly, if they have prescriptions that the medication that they take on a regular basis, can they have those prescriptions transferred over here in the
Yeah,
US?
so it's if it's from your home country, I'm gonna suggest, and this is an excellent question. So if you have prescriptions that you're taking, or there's a medical concern or issue that is ongoing, I'm gonna ask you to please set up an appointment as soon as possible with the provider here, so that the provider can get some medical history on you, go over your situation, get to know you and figure out a game plan for you here and write the prescriptions from a US provider here. Okay. They will have to be written by US provider here. Prescriptions from outside the country written from a provider outside the country will not be valid here with the insurance company or with the pharmacy. So you will have to have them written by a provider here in the US. So again, if you need that, I would schedule an appointment through your patient portal as soon as possible. Okay, so you can get that set up. And again, remember, insurance companies, to again paint a bigger picture for you, insurance companies have a large list of prescriptions and medications and drugs that they cover. They don't cover every single drug or prescription in the world. So if there's something that you got to discuss with the provider and it's maybe a prescription or a medication not covered by the plan, which is very rare, but if it is, then you would talk to the doctor to give you an equivalent medication or prescription so that it could be covered under the insurance plan.
Thank you for that. So a student had, and I don't know if you'd be able to answer this, a question said, can I add the card to my Apple Wallet? And I'm assuming they mean their insurance card. I don't have an Apple Wallet, so I don't even know if this is conceptually
Yeah,
possible. I don't know
yeah,
if you know the answer either, but that's
yeah.
the question.
You know what? They United Healthcare Student Resources also has an app. I don't think you can add it to your Apple Wallet, but you can download the United Healthcare Student Resources app. And I want to be clear because when you go to the App Store, if you just type in United, remember United is the largest insurance company in the US. So if you just put in United, the United Health Insurance Company app will come. That's not the one you need. You need the United Healthcare Student Resources app. And you can download that. And I don't know how how that would work, but you would have a digital copy of the card through that app. But I don't think you could download it to the Apple Wallet.
For that.
Yeah, that
All
was a good
right.
question.
Well, it is almost 11 o'clock. So, Luis, we want to make sure we're respectful of your time. Everyone, we hope that this was, oh, I realized my camera has been off. Wow. We hope that this has been helpful. And we will have these once a month. So if you end up having any kind of interaction with health insurance, or if you have any questions, you're not feeling well, once a month, Louise and team is going to be available for you for this live Q&A and any kind of updates that might be available. So we do invite you to come back with any questions that might be related to you throughout the semester. And that way, if you forget some of this information and you don't feel confident rereading these slides and knowing what to do, you can always come back to us. So please look on the ISSC website for our next health insurance webinar in February, which I think we have another one at the end of January. But that way, if you have any questions, but again, thank you so much for providing this for us and our students. And again, if you are not a graduate student, please just send us a message with your email. Otherwise, if you are an international graduate student, we hope that you are on our resource hub, because this will be uploaded as soon as I get the recording back from Zoom. But the slides are already up there. My student workers already added them. So you can find them in your welcome wallet since it's the beginning of the semester. But we will always have our health insurance information directly provided from our health insurance team on our health and safety module. So again, thank you. And we hope you all have a wonderful day. Happy first day of classes. And we hope to see you around. Thanks again. Bye.